For Session Update, I'm Shannon Lurkey. Earlier today, Senator Chris Eaton held a press conference on the Minnesota Compassionate Care Act of 2015. The Committee on Health, Human Services, and Housing is expected to continue testimony on this issue again at 4:30 this afternoon. Here's that press conference.
Good morning. I'm Senator Chris Eaton, and I thank you for this opportunity. I've really enjoyed starting this discussion across the state of Minnesota on options for at the end of life. And I'd like to start this press conference with Mr. Dan Diaz, who is the husband of Brittany Maynard.
Thank you. Thank you. And I'd like to start by thanking the senators, the authors, the sponsors and co-sponsors of this legislation. My wife Brittany died on November 1st of 2014. We had to leave our home in California and move to Oregon so that she could access medical aid in dying and ensure that she could have a gentle passing if it were to become necessary for her. Brittany underwent an 8-hour brain surgery, and we researched every treatment option that was available. Unfortunately, the tumor was growing aggressively, and she was told that she had 6 months to live. We moved to Oregon. We had to pack up half of our house into a U-Haul truck, find a house to rent on Craigslist, establish residency, find a new medical team, say goodbye to our friends and family. Nobody should have to endure that at their end of life. Minnesotans deserve better. I made a promise to her to do what I can to help move legislation forward so that nobody would have to endure what we did of having to leave our home after being told that you only have 6 months to live. But to share something directly from Brittany, she said this. Brittany acknowledged that this is not about her. This is about anyone that finds himself in that predicament of being terminally ill. There are hundreds of Minnesotans that could potentially benefit from simply having the option of applying for medical aid in dying. And then they are the ones that are in control. They are the ones that are taking that control back from their illness so that their final few days can play out peacefully, so that that person can have a gentle passing. That is what this legislation is about. At its crux is simply allowing the individual to make the decisions that are right for them in concert with their own spiritual beliefs, with the support of their family, and with their physicians. That's it. The opposition likes to swirl a lot of things into this to muddy the waters. Their campaign is based on fear. My wife was making decisions based on the reality of what she was already enduring, the suffering that she was already going through, and the recognition of what was coming for her. A terminally ill individual is the only person, is the perfect person to make the decisions regarding how their final few days will play out. That's not up to a religious organization, a legislative body, or a medical institution. The sanctity of the physician-patient relationship is what needs to dictate this decision, just like any healthcare decision that a person makes. On November 1st of 2014, the weeks and months leading up to that day, my wife was, the symptoms that she was suffering from continued to increase. Pain that could not be alleviated with morphine, seizures, when they would occur, would leave her unable to speak, unable to communicate for hours. On November 1st, within 5 minutes of taking the medication, Brittany fell asleep very peacefully. Within 30 minutes, her breathing slowed to the point where she passed away. That's the gentle passing that this program affords a terminally ill individual. That is what should be available to any terminally ill individual in Minnesota and any state in this country. But again, this was not about Brittany. Her case got a lot of attention, and in keeping my promise to her is why I'm here to speak with the legislators. But by contrast, I'd like to next introduce a Minnesotan who will share the experience that her mother had to endure. So, Sally.
Thank you, Dan. My name is Sally Settle. I live in Apple Valley, as did my mother, who passed away last year. I was at the doctor with my mother when she was told she had leukemia and might have 6 months to live. Well, we knew what we were headed for. My sister at 34 died of leukemia, and my father died of a brain tumor at 62. My mother was 75, going on 40. So the first thing we did was plan a very aggressive attack, trying to figure out how to make her end of life as full of life and as long as we could, keeping in mind the quality of life that she wanted. After we had that plan, we met with the palliative care doctor. She wanted to know, how is my end going to come? How is it going to be? Well, for her diagnosis, she could have died from a complication, but most likely the blood transfusions would quit working and she would bleed to death over several days out of every orifice of her body. So this is what she was facing as a likely end of life. Our recommendation to our family was to have a lot of dark colored towels to minimize the trauma to the family through the experience and to my mother. She thought this was absolutely ridiculous, and we started looking at options, particularly due to the bravery of Brittany and what she went through. We saw the magazine in the oncology clinic, and so she said, Sally, we have to move to Oregon. I'm not going to face this death this way. She decided that she couldn't leave her 14 grandchildren behind in order to get the care that she deserved at the end of her life. So then she asked me to buy her a gun. I had to talk her out of that too. I told her I was not going to try to explain to her 14 grandchildren that she shot herself in her backyard. There are two things my mother could have avoided if we had this right to die as we choose in Minnesota. She could have avoided the last 3 days of torture she had in the hospital where she died, where she did not want to die. But equally important, she could have avoided the total fear and terror of how the end was going to come for her. Having those pills in her nightstand would have made her ability to fight for the quality and length of life she could have, would have given her a lot more strength. Not only did she deserve to die how she wanted to die, all Minnesotans deserve to be in control of their death as much as we're in control of our life. This is critically important legislation, and we need to pass it as soon as possible. I miss you, Mom. I'm here because she asked me to be. She begged me before she died to get involved so that no one would have to go through what she went through. Thank you for your attention.
I just want to reiterate that we have options in Minnesota. You can shut off life support. You can stop taking nutrition or fluids. You can stop treatment. But all of those do not preclude the end of the process when the body's breaking down in a disease, with a disease. So I really think that this is another tool that we can use to show humanity to ourselves as we're in the last days of life. No one likes to look at their mortality. We're all going to die someday. And I think that the discussion needs to continue. We need to have these discussions with our family members so that everyone knows what our wishes are, and so that people can more thoroughly understand what it's like for the family and for the person going through this. I'd like to introduce Mr. Thaddeus Pope. And he's what is your title?
I'm the director of the Health Law Institute at Mitchell-Hamlin School of Law.
Thank you. And I have with me Senator John Marty, who'd like to say a couple words.
I just want to say that I'm really pleased that Senator Eaton and Representative Freiburg have been having hearings around the state to have these conversations, because they're very painful conversations that individual families have, and they don't have the choices that they should have. And this is simply to make sure we start at the legislature now to start talking about this and around the state. I think attitudes change very quickly. I think the polls suggest there's strong support for people having the choices, but we are getting those conversations going now. We've been having a lot of good ones, good positive discussions of the importance of choices for people. And at the hearing we had at the Capitol a couple of months ago, I think it was a very respectful discussion with people with concerns on both sides expressing their options, what they want to see happen. But I just think what we have to have is we have to make sure that people here don't have to talk about the painful thing of saying goodbye to all their loved ones here and moving to Oregon so they can end their life in a way that's more humane, a way that's more caring and more compassionate.
I have Representative Mike Freiburg. He's the House author of the bill.
Thank you, Senator Eaton. I do want to thank you for your leadership on this issue. This, is a very personal issue to very many people. It's the first time we've had these discussions. I think the deliberate approach that she's been taking on this, having listening sessions around the state, has really served the process well. Both for educating the public and, frankly, educating me on this. I mean, I've heard so many truly heartbreaking stories from people who've dealt with really difficult decisions at a very difficult time. This, bill would only be able to be used under very narrow circumstances. My hope is that it can give people peace of mind at a very difficult time, whether or not they choose to take advantage of what the bill offers.
I guess we're up for any questions. Are there questions for any of us?
How is it determined that a patient is mentally competent to make this decision on their own?
Their doctor will do a mental health assessment, and if he has any questions, they'll be referred for a complete comprehensive mental health exam. And then they have a second doctor that has to do the second opinion and confirm that they have the diagnosis of that they will likely not live more than 6 more months, and that they are competent to make this decision, and they're not being coerced, and that they're aware of all the alternatives. Yes?
What sort of reporting, if any, would be required?
In the current bill, there isn't any, but we have listened to people across the state who have indicated that they'd be more comfortable if we kept data and did an annual report. So that is in my amendment that will be added to the bill.
Is this something that you expect to make significant progress on, move ahead this year, or is this something you're setting up for future sessions?
I do not expect it to be heard in the House. We are having the hearing in the Policy Committee for Health, Human Services, and Housing, and I expect that we're going to need to continue this conversation across Minnesota, and I'm quite frankly looking forward to it. It's been a truly gratifying experience.
You waited a year since you introduced it last year. What did you learn in that year from touring the state?
Well, we were in Mankato, Duluth, Brooklyn Park, and we had one here in St. Paul. And I did both of the Minneapolis and Duluth campuses of the university. And I think what I heard was that